there's about 4 types of plasters you're going to potentially be involved with, okay? They're a bit of a variation on a theme. So you're going to have a below elbow, above elbow, below knee and above knee, okay? We're going to look at below elbow and hopefully we can fit in an above elbow as well, okay? So what's really important is that you ask the clinician what type of fracture it is. Because if it's a buckle fracture or a green stick fracture, they don't need a plaster, okay? They need one of these, all right? So it's important you know what you're plastering, all right? Any questions? No. Fab. So you will need a tape measure, an arm, a soft woolly bandage, a crepe bandage, whatever you call them, and one of these little stockinettes that go on the arm, and your plaster, which comes in 3 different sizes, and obviously based on the size of your patient you choose the most appropriate one, and they come in thicknesses of 5 layers, and you don't need to change that. We're just putting 5 layers on, alright? So when you're measuring, I was always taught to put 2 fingers in the joint and measure from the 2nd finger down to the knuckles, okay? The plaster will shrink and you don't want it too high up that they can't bend their arm or they're getting problems with pressure sores, okay? So cut your 5 layers to length. And then what you need to do is round off the corners so we don't get any sharp spiky bits sticking in skin. And if you want, you can cut a little corner out for the thumb, but you don't have to, you can just fold it over. I do that sometimes. If you want to cut a little corner out, it's perfectly acceptable to do so. Yeah? Mm-hmm. So your first job is to put stockinette on their arm, so I just gauge it. It's better to cut too much than have it too short. So put your hand in like that, hold your patient's hand and then just slip it over their arm, okay? So you want a nice portion above the elbow and you want a nice portion below the knuckles to fold back to make a neat edge, alright? Then you cut a small hole for the thumb. Any questions? Ask questions anytime, it's fine, even if you think it's a silly one, because invariably it won't be. So your next layer is your soft band. This is just a soft woolen bandage, okay? And I start right up in the joint because this is going to form part of your edge that you fold over, okay? And you do half and half like a normal traditional bandage as you go down the arm, okay? Try not to have any creases in it. And it's quite good, you can kind of manipulate it around the landmarks of the body. So you can either tear it here or put a hole in the thumb for the thumb. It truly doesn't really matter. And you don't want to go all the way back up, you just want 1 layer, alright? So that's what it should be looking at this point, okay? So there's lots of different bandages up there, so you want one of these, right, they're quite thin, I think they're called crepe bandages. Your water, have a feel, just wants to be lukewarm. Mm-hmm. Have a feel. And the reason that's important is if it's too hot, it will get really hot when you put the plaster on because it gets warmer as you put the plaster on, okay? So you don't want to be causing them discomfort. Get your bandage nice and wet and have it ready, good to go. And you get your plaster. So you hold it like that and you put it in the water and you give it a wiggle around, pull it out and then you just squeeze the water out and then open it up. Don't be doing this because that will scrape all the plaster off, okay? Then you lay it on the arm. You've got plenty of time to work with it, you don't need to panic. So make sure you've got it at the right length here. Make sure you got it nicely just above the knuckles, okay? Lying on top of the arm. Make sure, if you have a look at these little, all these little holes in the plaster, you need to make sure you get rid of those, okay? So you smooth it all in like that.
Okay.
And that helps strengthen the plaster, okay? Then you can fold your nice neat edges over. So around the thumb you can just cut to make it a bit neater if you want. And then I always start at this end because it just feels a bit easier when I'm left-handed, so it might be easier for you to start that end. Doesn't really matter. Again, you can either put a hole in or you can just twist it and go through like that. Or you can do a hole like that. It's up to you. And you can go back up with this bandage because it's not that thick. And then you need to tie it off, so extend the bandage out, split it in two. So just tie a little, as if you were tying your shoes, and then you can go around plaster like that. And tie it in a knot, but obviously not super tight, yeah? You should be able to be quite loose. And that's it. So you've got enough space to bend your arm, and it sits nicely above the knuckles, and it's all nice and neat. And you've got plenty of room to room your thumb about. Any questions? Quite easy really, isn't it?